Hi, I'm Morgan Jaques, and I'm presenting research that I'm currently about 1/3 of the way through of this study, Women in the Dual Roles of Self-Employment and Unpaid Caregiving, Impacts to Health and Well-Being. According to the Canadian federal government, the fact that women make up a minority of self-employed Canadians, currently at 38%, indicates a barrier they intend to help women overcome in order to gain equal access to self-employed work. Now, the COVID pandemic has accelerated this push, with self-employment positioned by governments of OECD countries as a means of economic recovery from the pandemic. But even before COVID times, the Canadian government was devoting significant resources toward increasing the number of self-employed women in Canada. Their Women in Entrepreneurship strategy is a key indicator of this drive. This was a program that was launched in 2018 with the goal of doubling the number of almost 1 million self-employed women in Canada by the year 2025. The term entrepreneurship still has an aura of success, accomplishment, exciting innovation, and independence. But the fact is that the quality and precarity associated with self-employment varies widely. Self-employment is characterized by similar or even exacerbated occupational segregation compared to waged and salaried work, meaning that within self-employment, women tend to be concentrated in the lowest paid, most precarious jobs and to suffer the highest cost to their health and well-being. But not all women in self-employment experience these conditions equally. So in the interest of expanding our understanding of this variation, this study builds on previous research that shows that women who are self-employed face risks to their health, as do women who are primary caregivers. If that is the case, then it is crucial to explore the experiences of women who are carrying out both roles simultaneously, as these women would be facing daily work that constitutes a double threat to their health and well-being. When injury or illness comes into the picture, it is difficult for women who are self-employed and who perform a primary unpaid caregiving role to either recover or maintain income stability. In the following 3 slides, I'll address some of the most relevant background research on each of these 3 triangle points. Within the category of self-employed women, this study focuses on the subset that is at the highest risk of negative impacts. That is, women who are solo self-employed, meaning they have no employees, and who are unincorporated. These tend to be the most precarious and to have less human capital upon entry into self-employment, and to subsequently earn less than their waged or salaried counterparts. This group makes up the largest proportion of self-employed women at roughly 60%. Within that group, social location is also a significant factor, with immigrant and racialized women experiencing more precarity and worse working conditions than other women. The occupational segregation that characterizes regular employment, where women tend to be concentrated in lower paid service and person-oriented work, is reflected and even exaggerated for self-employment, where the largest numbers of self-employed women are found in the healthcare and education sectors, performing person and service-oriented roles. When you combine those realities with caregiving, the picture gets a little worse. Many women seek out self-employment because they are influenced by the narrative that the independence of self-employment is a good way to combine income earning and their care responsibilities. It can look all the more appealing when women caregivers experience discrimination in regular employment. So all of this takes place in the context of caring labor being undervalued both economically and socially. Even when not combined with other paid work, it is hard on women's psychological and emotional health. Caring labor is isolated, exhausting, and invisible. It comes without benefits or the social support of coworkers to mitigate the stress and isolation. It is therefore no surprise that unpaid caregivers are at a higher risk for disease, both short and long term, and take longer to recover from illness, have more frequent hospitalizations when ill, and report higher levels of emotional distress and depression. Caregivers have also been found to experience increased psychiatric symptoms, lowered life satisfaction, and a significant negative association between health and caring that increases with number of hours of care provided. Women caregivers tend to provide more intense care for longer periods and to experience a larger reduction in income than men as a result of their caregiving work. So I want to thank Taib, who has illustrated more eloquently than I would be able that there is indeed a serious gap in health coverage for self-employed workers in Ontario. So rather go into great detail about this situation and risk overlapping messages, I would just like quickly to summarize that the category of self-employed workers I am interviewing suffer greatly the consequences of always needing to make a choice between recovering from their illness or injury and keeping their income as steady as possible. And in the case of women caregivers, even were they able to access sick pay, they would continue to work as caregivers because that is already uncompensated labor that never ceases. As I will show closer to the end of this presentation, the caregiving element represents another dimension to this serious policy gap for women solo self-employed workers. So the design of the study is essentially qualitative interviews with solo self-employed women who are also unpaid primary caregivers living and working in Ontario. I began these interviews in October of 2023, and I am now approximately a third of the way into the data collection stage of my research, meaning that I have conducted 8 interviews out of the 25 total that I would like to conduct. I'm interested in a number of questions surrounding caregivers and solo self-employment, such as how women come to be working these dual roles and the type of supports they feel would help them in their work. For today, though, I will focus on the research question exploring the health and well-being aspect of their working lives. How do women perceive the impact of combining solo self-employment and unpaid caregiving on their health and well-being? To my knowledge, no previous study has combined the 3 elements that I have listed here. The majority of studies tend to combine classes or genders of workers. That is, solo self-employed people are lumped in with those who are employers of others, or to combine women and men in the same study. By focusing on solo self-employed women, I am separating out the category that previous research has suggested is most vulnerable to detrimental impacts to their health. Among the research devoted to women's self-employment, I noticed a lack of research that explored how women experience their work and how they subjectively construct the meaning that engaging in these types of labor carries for them. This is a gap I aim to address. The following slides represent early data analyses conducted on the 8 qualitative interviews with women living and working in Ontario. The first theme that I find strongly emerging is that there are no safety nets for the self-employed. There are no sick days. I heard this phrase repeated many times by all of the women that I've interviewed in various ways. Their work is paid by the hour and by the project. If they don't work, they don't get paid. Adding to this hardship is the fear that taking time off for illness could result in long-term consequences in the form of lost clients, or that they could gain a reputation for prioritizing their family's needs. I have heard multiple times of women working from their beds, concealing from their clients that they are sick, continuing to respond to clients' demands, and at the same time still responding to the majority of their children's needs. One participant I spoke with had a scheduled surgery that meant she would need to stay in the hospital for 2 nights. She spoke with true excitement about the books she was going to read and the pleasure she would take in simply being able to rest without leaving her bed to meet her family's needs. Another participant who had recently undergone cancer treatment spoke of the chemotherapy appointments at her local hospital as an enjoyable respite from the demands of her labor in the home. The seriousness of these women's health procedures would mean they would be forced to take a short break from their caring labor and from paid work, but in the majority of illness and recovery scenarios experienced by these women, both their caring and paid labor continues unabated, and their recovery must simply fit around their working lives. A second clear theme that has emerged is that the women in the study struggle to find the time, energy, or funds needed to access the things that might sustain them better in their work. As caregivers, they all tend to put the needs of their families first, and as self-employed workers, they are often forced to put their clients' needs ahead of their own. When family vacations are possible, for instance, they are still performing either all of the care for their family or a disproportionate amount relative to their male partners. One woman mentioned that her vacation the previous year consisted of a few days of camping with her husband and children, during which she stayed accessible to her clients via her laptop. In my interviews so far, I have noticed women have the most difficulty answering the questions surrounding self-care. Simply, what do you do for self-care is often met with moments of long silence. Sadly, it seems that for many women, self-employed caregivers, self-care has become a thing of the past. They describe trips they used to take, activities they used to pursue. One woman spoke nostalgically about how before children, a sick day was a day that she actually spent resting and not going into work. Self-care seems to have become something they struggle to identify in their current lives. The third and last theme I will discuss today is what I've started to think of as the flexibility trap. This is a phenomenon that has been discussed somewhat in research in paid work in regular employment environments. And it seems that the self-employed environment is rife with that for women as well. The appeal of flexibility is a primary reason women report for their entry into self-employment, without having to meet the demands of a regular work environment that does not allow them to meet their family's care needs, and yet their flexible paid work schedules mean that they are constantly working around their family's needs. This flexibility means the gender status quo is maintained in households, with women doing the majority of the care work. It also means they tend to reduce their paid work hours and to overall struggle to be as successful within self-employment as their male counterparts. One participant said that her partner is entitled to only 2 sick days per year, and because their young children bring sickness home from daycare and school and they make their parents sick, her partner's sick days are always used up by the end of January, and those are used for his own recovery. Because the secure income that her male partner brings home represents the family's only predictable and stable income, everything must be done to protect their job status. These types of situations mean self-employed women tend to adjust their work schedule in order to accommodate children's illnesses and to work through their own illnesses. Participants spoke of this situation with a combination of gratitude for the stability their partners provide, but also frustration with the obstacle that their flexibility represents to more income and success in their own self-employed work. And this is the best case scenario for women. In the case of women who are solo parenting, or when both parents are precariously employed, there is no stability whatsoever to offset the stress of the precarity in their lives. So in terms of potential contributions, as I said, I'm only partway through the study, and so I'm looking to the future to think what is emerging that could be useful. And I think apart from raising awareness about the working lives of women in these roles, I hope that my research may in the future inform policymakers and others who are in decision-making roles about the needs of self-employed workers in general, and in particular those who are also caregivers. Regarding the first quote, it illustrates the needs for policymakers to gain an understanding of self-employed women's experiences at a finer grained level than is currently available to them. I hope to primarily bring attention to the lived experiences of women that is being played out invisibly behind the scenes. When it comes to self-employed women who are often working from home, who are also performing their caring labor in the private sphere, we are talking about a population that carries out all of their work invisibly. Without increasing our awareness about what they face in their work, it is impossible to create policy that truly addresses the needs of this population. The second quote is from a Statistics Canada report that was released just earlier this month. I believe it indicates an increased urgency to understand the experiences of these women, and particularly in that most precarious of self-employed categories, which is the solo self-employed. In many ways, the information contained in this report is nothing new, except that it reveals that although the overall percentage of self-employed women relative to men in Canada remains roughly the same as it has for decades, actually it has decreased slightly, the proportion of women in certain self-employed categories is growing. Gig work is a job arrangement well known for its precarity, lack of benefits, generally low pay, and that these aspects of the work tend to hit women harder than their male counterparts. As this quote shows, people are still drawn into self-employment under the impression that it will be the path to fulfilling their dreams, exploring their passion projects with independence and freedom. The results that I have seen so far support that of decades of gender-based research, indicating that if self-employment does fulfill these expectations, it is more likely to do so for men, or we could say for those without primary caregiver responsibilities. My research gives us more insight into why this could be the case. My hope is that policymakers take note and can take these and related results to the table when they are designing programs such as benefits for self-employed under the federal employment insurance. which has a shockingly low enrollment rate of 4% of eligible self-employed people. How can such programs better support women? They can start by considering what women face when they lack such basic benefits as the minimum number of sick days offered by employers in Canada. Thank you very much. I also have references available if anyone would like any.